Today I'll be talking about mental health awareness in India. So this presentation I have aimed to present it in a manner that it is easily understood by normal public, not only psychology professionals. So I wouldn't be talking about psychological jargons and all. So first, let's understand what is mental health. For most of us, mental health simply means that anyone who is not suffering from any mental illness, he is mentally healthy. But it is important to understand that there are many conditions which are not diagnosable, but still people they do suffer. So it is not simply the absence of mental illness, but rather the presence of the positive qualities. Like it is the foundation for well-being and effective functioning of individual. It is a state of well-being in which individual realizes his own abilities, is able to cope up with normal stresses of life, and is able to work productively and contribute to his own community. Now let's see the what are the indicators of normal mental health. Next, please. So whoever is mentally healthy, he will generally have these qualities in him. The first is reality orientation. Anyone who is mentally healthy is generally aware of his surrounding, about his own self. The person is aware about his abilities, self-awareness, and the person will have adequate level of self-esteem. Generally, if we see conditions like depression, the self-esteem of the person is lowered. Someone is healthy, he will have the person will be able to exercise voluntary control over his behavior. He understands what he is doing and why he is doing. So he will be able to form affectionate and long lasting relationships with others. Generally, we see in mental illness or in some personality disorders, this relationship aspect is disturbed, and the person will also be able to work productively and pursue his goals. Next, please. Now, let's see the status of mental health in India. Globally, mental disorders alone they contribute 14% to the global burden of disease. In India, approximately 6 to 7% population suffers from mental illness. That is, one in four family is likely to have at least one member with mental or behavioral disorders. But the problem in India is that though people they are able to know that they are suffering, they do not know what are the causes and what are the modes of treatment. They are not aware of the treatment facilities. So many of the people who are suffering from mental illness, they remain untreated. That is approximately 90% people they remain untreated. And we have witnessed during COVID-19 the cases of mental health problems increased by 20%. That is how we were able to give more importance. We got aware that we need to give more importance to mental health. Now, in India, government has taken some concrete steps to provide mental health services to all. So there is one program run by the government, that is National Mental Health Program. Under this, the government aims to provide mental health services at primary healthcare level. So this program has two aim. One is to provide specialty services in every district hospital. Under DMHP, District Mental Health Program, they have created a mental health unit in all district hospitals. So they have a team of specialists, or clinical psychologist, a psychiatrist, and a psychiatric social worker who are working in the mental health unit. Now, again, in the primary healthcare system, they are trying to train the general health practitioners to identify symptoms of mental illness and refer them to DMHP. Now, this mental health policy 2014, it encourages participatory and right-based approach for quality services provisions. Mental Health Care Act, which came in 2017, it aims to protect the right of the patients while they are being provided the services. Next, please. Now, let's see what are the common mental health issues which we encounter in day to day life: anxiety, stress and burnout, depression, psychosis, schizophrenia is one typical psychotic condition, and suicidal ideation. These are the conditions. Some of these conditions are diagnosable, some of them are not diagnosable at early stages. But we have to understand the moment we recognize that we are suffering, we should not hesitate in seeking help. Next, please. So, where do we seek help? Those who are from psychology background, they are generally aware who are the specialists where we have to go. But for general public, they do not know to whom they have to go and or which institute they have to go. So, first we can go to psychiatrist, then the clinical psychologist, psychiatric social worker, or if we do not have some diagnosable clinical condition, we are simply um, experiencing some adjustment issue, then we can go to a psychologist or counselor. Then there are some mental health institution, we can go there to seek specialist services. Next, please. Now, what are the challenges in delivering mental health services in India? It has been observed that there is general lack of awareness among people about the symptom of mental disorder, and they are also not aware about the treatment facilities that are available nearby. And moreover, since there is a lack of knowledge, it leads to myths related to mental disorder. People they generally feel scared of people who are mentally ill. They give label to people. They start name calling and discriminating with people. And also there is a treatment gap, like the number of people who are suffering with mental illness and the number of professionals that are available. It has been seen that generally one mental health professional is available for thousand of population, so which is a very insignificant number. But still, who whatever services are available, whatever professional are available, we have to utilize. Next, please. Now, one such challenges, as I talked about, is stigma related to mental illness. Stigma is like labeling individual uh, with mental disorder, we giving a tag, giving a name. So people, those who are mentally ill, who are stigmatized, they feel shame, they feel socially excluded, and they isolate themselves from others. They are generally discriminated by general public, and people who lack knowledge about mental health issues, they generally blame the patient about their illness. So what happens, people they try to maintain secrecy, they do not share their problem with others, and it actually creates hindrance in seeking help. Next, please. Now, mental health awareness, it is very important at this stage that we have to aware people about mental health issues. Now, health, being aware about mental health means that we are able to recognize psychological distress that we are suffering, and being able to recognize that self help is available, professional help is available. We recognize what are the causes that are actually precipitating the mental illness. And once we are aware, once we have the knowledge of mental health problems, we will be able to develop an attitude that will facilitate recognition and help seeking. So once we are aware, we'll be actually able to promote mental health. Now, how do we promote this mental health? We can spread awareness through conventional media like print media, writing articles in newspaper, or we can take use of internet and use social media and aware people about mental health issues. And also there are some government programs that I had discussed, through which government is also trying to aware people and make the services available. Now also there is a requirement that we incorporate topics of mental health in our education systems, so that while we are educating us, while we are in the studies, that time only we know some of the critical aspect of mental health. Next, please. Now, those who are not from psychology background, those for general public, this information might be helpful. These are some of the institutes where one can seek help, professional help. The first institute is NIMHANS, which is in Bangalore, then IBHAS, Delhi, Central Institute of Psychiatry, Ranchi, RINPAS, again in Ranchi, and Institute of Mental Health and Hospital, which was earlier known as Agra Mental Hospital. Also, there are services available at our district itself under district mental health program. Under each district, as I said, under each district there is a mental health unit, and also there are some de-addiction and rehabilitation centers available. Next, please. Also, those who cannot approach physically, they cannot visit to the hospital. There are some tele counseling services also available. They can simply call and seek help. So there's under RCI also there is a list of professionals. The contact details are given. People can actually contact professionals directly from that list. Also, there is one initiative by IACP Paramarsh under which telecounseling services is being provided. Also under NIMHANS also they are also running a telecounseling unit. Also in Ministry of Health and Family Welfare, they have also created a list of professionals and they have circulated it so that people can take help from professionals. Next, please. So I would like to conclude my talk by saying that we have to give equal importance to mental health as we give to physical health. So there cannot be true physical health without mental health. Thank you. If you have any question related to mental health, you are free to ask.
Thank you so much, sir, for providing an insight about the condition of mental health in India and also the role of awareness in it. First of all, I would like to ask that there is a very important role of mental health professionals while dealing with such kind of problems. So, as you also mentioned, there is a lack of mental health professional as per the population, as we see the data. So, in your opinion, how we can inspire the students or the aspirants of psychology to come and serve in this field? What is your advice and what is your, we can say, guidance to the aspirants of the psychology?
Generally, we see psychology more than 50% of the student they enter in clinical field itself. So, but the problem that they face generally is that they are not aware which institute they have to go, which course they have to pursue to specialize in this field. So, at present, there are two courses which allows clinical practice. One is diploma in mental health. Again, it is a RCI recognized course. Second is MPhil in clinical psychology that they can pursue, and they will have a, I'll say, ample clinical exposure, so they can learn about cases of mental disorder and what are the therapies that are to be provided. So they can actually the institutes that I mentioned, they also offer these courses, so they can actually uh, check the admission procedure and all, and they can actually train themselves in that.
Uh, you have mentioned about the IACP, Indian Association of Clinical Psychologists. Also, you are a member of it. So, what are it is contributing to society and how it is working? Give a brief about this association and how someone can take guidance from it. What are its various fields of serving humanity?
Through ISAP, we are trying to first we are trying to ensure the quality services being provided by professional. Must it is generally seen that since there is a lack of awareness among people where they have to seek help. So what happens? There are many people who are not qualified, like they do not have much clinical experience. They are not trained in clinical setup, but rather they have completed courses in universities, etc., they are also offering clinical services. So what happens that people, those who patients I'm talking about, people patients who approach to unqualified professional, so they tend to have a negative experience. They now they will also feel that professional cannot help, but actually they do not know that they have not taken help from actual professional. So one, we are trying to ensure that whatever the services are being provided, it is being provided by a trained professional, and the quality be ensured. Second, we are also, as I said, one initiative is Paramarsh. We are offering telecounseling services. Then we are conducting webinars and seminars regularly to aware people about the topics of mental health.
So we can say that this association is working very big in this field from many decades and serving the humanity in a real ways, especially the professionalism. When we talk about the professionalism in the field of psychology, then we have to say it is providing it in a nice manner. Sir, when we talk about different fields in the field of psychology, especially in India. As you mentioned, the institutes, the two major fields is one is the clinical field and another is just a general field of the psychology. Or we can say that
Yes,
uh, we can say just academic field. So, in your opinion, how a student, how his parents should select whether he has to go, he or she has to go to a clinical field or he has to go a non-clinical field in the field of the psychology. So, what are the qualities and on what basis a student should select a clinical field or a non-clinical field?
okay. So this totally depends on one's intakes, or whether the person is interested to serve in a clinical setup. And also, like see, teaching, it depends on okay, but the clinical services, to offer clinical services, you need to actually developing those skill, it requires rigorous training. Clinical services, and many those, even after training, they actually depends on one's interest. If someone has interest in clinical, then only they should go in clinical. Otherwise, academic is also okay.
Uh, when we talk about the mental health, so what will be the preventive measures should be keep in mind by the general public or the client or anybody when we are facing so much disturbance in mental health in
That actually precipitate or indirectly contribute to our mental health problems. And also, see, individual differences is there. Not easily get affected by normal stresses of life, but someone may get easily affected. So people not uh, get affected or accumulate the socially, like as a preventive step, also can visit the counselor, or they may enhance their social circle where they can actually ventilate about their problem, discuss their problem. So there won't be like a pent up of feeling of some burden. So one preventive measure could be like enhancing social circle, enhancing life skills, and then when actually facing adjustment issue, so at an early stage, seeking professional help.
Thank you so much, sir, once again for your valuable time. Before winding up this session, what will be your conclude message, or we can say to the whole the humanity, what you want to say on this occasion through this session to whole the humanity?
Get into rat race and the stresses of life. That's it.
Thank you so much, sir, for your valuable time, presentation, and insightful session. Uh, it will truly inspire, it will truly provide a guidance to the mental health professionals and general people too about the mental health